So hello students, let us discuss some important points, important topics of histology. Just a brief review, a rapid revision of histology, right? Now let us understand the various types of epithelium. The various types of epithelium. Now what are the different types of epithelium? Let us understand the different types of epithelium. One is a simple epithelium. Simple epithelium is the one in which the cells are, all the cells are resting on the basement membrane. That's a simple epithelium. All the cells are resting on basement membrane. So this is simple epithelium. If the cells are flat, simple squamous. If the cells are cuboidal, height and breadth is the same, that is simple cuboidal. And if the length is more than the breadth, that's simple columnar. So where do we get this simple squamous epithelium? That lines the alveolus, that lines the blood vessels, that is endothelium, that lines the peritoneal cavities, the peritoneal membranes. Clear? So that is simple squamous. Simple cuboidal epithelium, where do we get? We get in the PCT, DCT, yes, in the thyroid follicles of thyroid gland, simple cuboidal epithelium. Anywhere else? Simple cuboidal we get in ducts also. Simple columnar epithelium. Simple columnar epithelium, where do we get? We get in the GIT. Simple columnar. Simple cuboidal epithelium, how's the nucleus? The nucleus is circular and the nucleus is in the center of the cell. Rounded nucleus. And what about simple columnar epithelium? The length is more than the breadth. And what about the nucleus? The nucleus is elongated along the long axis of the cell. Okay. All the cells are resting on the basement membrane. Now suppose if there are multiple layers of cells, the cells do not rest on the basement membrane, that becomes a stratified epithelium. Now if the topmost layers are flat, that is stratified squamous. If the topmost layer is cuboidal, stratified cuboidal, and then similarly stratified columnar. Now where do we get the stratified squamous epithelium? If there's a keratin, it is stratified squamous keratinized, that we get in the skin. If there's no keratin, stratified squamous non-keratinized epithelium, we get in the esophagus, we get in the vagina. Okay, stratified squamous non-keratinized. Stratified cuboidal epithelium, students, where do we get stratified cuboidal? In the ducts of the glands. And stratified columnar also in the ducts of the glands. Okay, so there's another epithelium in which the cells are multi-layered, but all the cells are resting on the basement membrane. It gives a false appearance of stratification. We call this as pseudo-stratified epithelium. And this pseudo-stratified epithelium will have cilia. This is the characteristic of respiratory epithelium, pseudo-stratified ciliated columnar. Okay. And we have got another type of stratified epithelium in which the topmost cells are umbrella-shaped cells. What is that epithelium? Topmost cells are umbrella shaped and this cells can stretch themselves. This is transitional epithelium. Transitional epithelium is a characteristic of urothelium, urinary epithelium. Okay, so that's how it is. So this is what I've put here for you. You can just go through it later. I've just written it here. So what is the function of all this epithelium and what are the types? That is stratified squamous, stratified cuboidal, simple squamous, simple cuboidal, simple columnar, and this is stratified epithelium. This is pseudo-stratified, stratified squamous, stratified cuboidal, okay, and urothelium. So these are the different types of epithelium, the sites where it is seen and the functions of those epithelium. I've just put it on the paper for you. You can have a look at this. Now coming to the glands, depending on the number of cells, the glands are classified as unicellular or multicellular. Unicellular gland is a goblet cell. Multicellular gland is a submandibular gland. Depending on the duct, if the duct is simple, it does not branched. It is sweat gland. And compound meaning branch duct, mammary gland. The mode of secretion, if the apex of the gland breaks off, that's apocrine. If the entire gland breaks off, that's holocrine. And if there's no breaking up of the gland, the secretions are transmitted by the process of endocytosis. Okay, there are vacuoles which will go to the periphery and they'll break. That is merocrine gland or eccrine gland, eccrine. The example of apocrine gland is sweat gland. Holocrine gland, the entire gland breaks off sebaceous gland. And merocrine is mammary gland. Mammary gland. And depending on the type of secretions, it can be a mucus gland, a serous gland, or a mixed gland. Mucus serous or a mixed gland. Now have a look at this. What is the functional unit of a gland known as? A functional unit of a gland is known as an acinus. Acinus is a group of cells which encloses a lumen. A group of cells enclosing a lumen is known as an acinus. Now, if this acinus has got cuboidal cells here, cuboidal cells like this, and this is another acinus which has got tall and columnar cells like this, tall and columnar cells with, how's the nucleus here? The nucleus is in the center of the cell here in a serous acinus, and this is flat nucleus at the base of the cell. So this is a mucus acinus and this is a serous acinus. Serous and mucus. So acinus is a functional unit of a salivary gland. It's a group of cells which encloses a lumen. If this is how a serous acinus looks, a cuboidal cells, right, and this is columnar cells, so that's a mucus acinus. If there are plenty of serous acinus, this becomes a serous salivary gland. Serous salivary gland example is parotid gland. Parotid gland. If there are plenty of mucus acinus, that becomes a mucus salivary gland. Example is sublingual gland. Sublingual gland. Okay, and sometimes there is both serous and mucus acinus together. That becomes a mixed gland. Mixed gland. Or sometimes you may have a gland like this. You can have a mucus acinus. Look, that's a mucus acinus, and sitting on the mucus acinus is a serous acinus. Yeah. So sitting on the mucus acinus is a serous acinus like this. This is a mucus acinus, and sitting on the mucus acinus is a serous acinus. This is known as a demilune. And demilune is a characteristic of a mixed salivary gland. Mixed salivary gland example is submandibular. Mixed salivary gland is submandibular gland. Clear? So this is just to tell you what is a serous mucus acinus, a mixed salivary gland. So what is this? This is mucus acinus. And what is a mucus acinus? Secrete mucus. And this mucus gets dissolved during staining, because of which the mucus acinus looks empty. Empty. Okay, mucus acinus looks empty. You see this now. This serous acinus looks colorful. These are all serous acinus. And serous acinus looks colorful because of the presence of granules. We call them as the zymogen granules. Zymogen granules. Okay, and look at this now. This is a serous acinus. This is a mucus acinus. You can see beautiful mucus acinus, serous acinus together. So this becomes a mixed salivary gland. Or can you see a structure here in which this is a mucus acinus, and sitting on the mucus acinus is a serous acinus. This is known as a demilune. Demilune. So this becomes a mixed salivary gland. Just remember the examples of this glands. This is what is asked in the MCQs also. Clear? This is another example of demilune. Clear to all of you? So which of the following is a holocrine gland? Example is sebaceous gland. Sebaceous gland. Yeah. Demilunes are present in large number in which gland? So demilunes are present in a mixed salivary gland. Example of mixed salivary gland is submandibular. Submandibular gland. Now, just understand the types of collagen fibers. This is very commonly asked in the MCQs. We have got 4 types of collagen fibers, and now 5th is also included. So type 1, where do we get? In skin, tendons, blood vessels, organs, and bone. Bone contains type 1 collagen. Type 2 collagen is found in cartilage. That's the main collagenous component of the cartilage. Type 3 we get in the reticular fibers. Reticular fibers. Type 4 is in the basal lamina, and type 5 are in the cell surfaces, hair, and placenta. So these are the different types of collagen. MCQs are asked on this. Okay, clear to all of you? Now coming to the cartilage, we have got 3 types of cartilage. One is hyaline cartilage, one is elastic cartilage, and the third is white fibro cartilage. White fibro. Okay, hyaline yellow elastic, and white fibro. In all these cartilages, perichondrium is present. Perichondrium is the covering. So perichondrium is present in all the cartilages except it is absent in white fibrocartilage. White fibrocartilage, perichondrium is absent. Now, this is a hyaline cartilage. You will be getting perichondrium here at the periphery. You'll be getting small chondrocytes at the border, at the periphery. And as we come inside, the chondrocytes becomes large. They become mature, and they are found in groups. What are these groups known as? This is what we call as the cell nest. This is what we call as the cell nest. Cell nest is a group of cartilage cells, chondrocytes. Cell nest is a group of chondrocytes together. That is known as cell nest, and this cell nest is a characteristic of hyaline cartilage. Remember, characteristic of hyaline cartilage. The matrix around the cartilage is darkly stained. Around the chondrocytes is darkly stained. That is territorial matrix, and the matrix in between is lightly stained. Interterritorial matrix. Fine. So perichondrium present, and this are the chondrocytes in group. Hyaline cartilage, example where you get hyaline cartilage is the nasal septum. Yes, nasal septum. Where else do we get hyaline cartilage? Thyroid, cricoid. Okay. Fine. So these are the sites. Then articular cartilage. Articular cartilage is also hyaline in nature. Just remember one thing, for the articular cartilage, perichondrium is absent. Articular cartilage is a type of hyaline cartilage, but perichondrium is absent because articular cartilage lines the surfaces of the bones, which takes part in the formation of the joints. The articular cartilage, perichondrium is absent. It's a type of hyaline cartilage. Remember. Now, what is this cartilage? You can see perichondrium here. You can see largest size of chondrocytes, and this is elastic cartilage. Elastic, yellow elastic cartilage. How do you identify what are the main points? You see large chondrocytes here, the largest size of chondrocytes, and we see fibers here. These are the elastic fibers in between with the perichondrium. So this becomes the elastic cartilage. Example of elastic cartilage is the pinna, epiglottis. These are the sites of elastic cartilage. Clear? Corniculate, cuneiform. These are all examples of elastic cartilage. And the third type of cartilage is white fibrocartilage. Now, white fibrocartilage, perichondrium is absent, and plenty of collagen fibers are present. Okay, this is collagen fibers are present, and because of plenty of collagen fibers, the chondrocytes becomes very small in size. You get the smallest size of chondrocytes in white fibrocartilage. This has the smallest size of chondrocytes. Example of white fibrocartilage is intervertebral disc, articular disc, menisci. Okay, so intervertebral disc, articular disc, menisci. So these are the sites where we get white fibrocartilage. Just remember the examples. You get MCQs on this. Sites of cartilage. So cartilage present in TM joint is fibrocartilage. So articular disc, menisci, intervertebral disc, these are all fibrocartilage. Clear to all of you? Okay. Articular cartilage is characterized by all the following except, yes. What is the characteristic of articular cartilage? It is devoid of perichondrium. Yes, perichondrium is absent. It is avascular. Yes. It lacks the capacity to regenerate. What do you say? It has a rich nerve supply. It is avascular and non-nervous. It is non-nervous, right? It is non-nervous. It lacks the capacity to regenerate. Yes. Clear? So it is non-nervous, it is avascular and non-nervous. Clear to all of you? Now, coming to this muscular tissue, we've got skeletal muscle, cardiac muscle, and smooth muscle. What is the covering of an individual muscle fiber known as endomysium? A group of muscle fibers are covered by perimysium, and the entire muscle is covered by epimysium. Now, you get striations here. Striations are characteristic of skeletal muscle and cardiac muscle. Both muscles we get striations, skeletal and cardiac. Now, what's the difference between a skeletal and cardiac muscle? In skeletal muscle, the nucleus is at the periphery. You can see this peripheral nucleus in a skeletal muscle. If we compare this to the cardiac muscle, this is TS of skeletal muscle. Nucleus is seen at the periphery. Now, if you compare this to cardiac muscle, what happens is, where is the nucleus? Nucleus is in the center of the cell. Have a look. Nucleus is in the center of the cell. In the cardiac muscle shows striations. Yes, the cardiac muscle also shows this. What is this? What is this that I'm showing you? These are the branching. And the cardiac muscle also has this. What are these? These are the intercalated disc. So what are the characteristics of cardiac muscle? Nucleus in the center, striations are seen, intercalated disc are present, as well as branching is seen. Okay, so that's about the cardiac muscle. About the smooth muscle is spindle shaped like this. It's a spindle shaped structure. The nucleus is in the center of the cell. Smooth muscles are found in the walls of organs or the walls of GIT. Okay, that's about the smooth muscles. Now understand lymphoid tissue. We've got 4 lymphoid tissues. In this lymphoid tissue, we get rounded. What are those things known as? What are these things known as? The lymphoid follicles. These are the lymphoid follicles. Okay. So we've got 4 lymphoid tissues: lymph node, spleen, tonsil, and thymus. So lymphoid follicles are present in all the lymphoid tissues except thymus. Thymus, no lymphoid follicles are seen. Remember this, students. Thymus, you can see this. Thymus, the lymphoid follicles are absent. Now the thymus has got a capsule. It's not shown here. The thymus has got a capsule here, and from this capsule we get septa, which divides the thymus into lobules. Like this is one lobule, that's a second lobule here. So these are the different lobules of the thymus. Lymphoid follicles are absent. Each lobule has got an outer cortex and an inner medulla. Outer cortex, inner medulla. And what is present inside the medulla? Inside the medulla, you get such rounded bodies, and this is what we call as the Hassel's corpuscles. Hassel's corpuscle is nothing but a degenerated epithelial cell. So Hassel's corpuscles capsule. From the capsule, we get septa, divides the thymus into small lobules. Okay, thymic lobules. Each lobule has an outer cortex, inner medulla. Medulla has Hassel's corpuscle, and this Hassel's corpuscle represent a degenerated epithelial cell. Thymus is a production of T lymphocytes. Okay. Now, if lymphoid follicles are present, that means it is either lymph node, spleen, or tonsil. Lymph node, spleen, or tonsil if lymphoid follicles are present. So now you tell me, what is this? What is this slide? Histological is, what is this slide? We get a capsule here. You can see this capsule, and just below the capsule, there's a space here. Look at this. Just below the capsule, there's a space, and this space is what we call as the subcapsular sinus. So subcapsular sinus is a characteristic of what? Lymph node. Subcapsular sinus is a characteristic of lymph node. Now, lymph node again has got a cortex and a medulla, and in the cortex, what we have? We have got lymphoid follicles here. These are the lymphoid follicles. The lymphoid follicles are present in the cortex, and the medulla contains medullary cords and medullary sinuses, right? So how do we identify lymph node? Capsule, just below the capsule is a space, the subcapsular sinus. The cortex has lymphoid follicles. The medulla has medullary cords and medullary sinuses. Perfect. Now, as we go down here, what is this? What are these known as? Crypts. And these crypts are characteristic of what? Tonsil. So in the tonsil, what are we going to get? Tonsillar crypts. And what is the epithelium lining the crypts? It's an oral epithelium. So it is stratified, squamous, non-keratinized epithelium. So what is the characteristic of tonsil? We get tonsillar crypts. The epithelium is stratified, squamous, non-keratinized epithelium. And these are the lymphoid follicles here that we get. Lymphoid follicles. Okay. So this is a slide of tonsil. And finally, we come to the last slide, that's a spleen. So spleen has got a red pulp and a white pulp. Spleen has got a capsule, and the capsule will send trabeculae. Spleen has got a white pulp. White pulp is nothing but the lymphoid follicle, and in this lymphoid follicle we get an arteriole which is pushed to the periphery. Look at this, an arteriole pushed to the periphery. It is known as an eccentric arteriole. Eccentric arteriole. So that's about the spleen. This is the white pulp. White pulp is nothing but the lymphoid follicle, and the rest everything is blood in the spleen, which constitutes to the red pulp. So that's red pulp and white pulp in the spleen. So that's how we identify the 4 lymphoid tissues: lymph nodes, spleen, tonsil, and thymus. So this you remember, these are the important things to be remembered in lymphoid tissues. Answer this. Subcapsular sinus is a characteristic of lymph node. Lymph node. Okay. Now coming to the GIT, you tell me now, students, what are the 4 layers of GIT? 4 layers of GIT: mucosa, submucosa, muscularis externa, and serosa. Mucosa, submucosa, muscularis externa, and serosa. What are the 3 layers of mucosa? One is the epithelium, second is the lamina propria, third is the muscularis mucosa. So mucosa is made up of 1 epithelium, second is the lamina propria, and third is the muscularis mucosa. This muscularis mucosa is a characteristic of GIT. GIT. Perfect. Now, the tongue. You get plenty of skeletal muscles here. Skeletal muscles. We get glands here. The glands in the tongue are known as the von Ebner's glands. Von Ebner's gland, skeletal muscles, and we get this papillae here, filiform, fungiform, and circumvallate papillae in the tongue. Okay. Slide of the tongue. Now comes the esophagus. Now, epithelium in the entire GIT is simple columnar except in the esophagus. In the esophagus, the epithelium is stratified squamous non-keratinized. So, epithelium is stratified squamous non-keratinized, plus in the submucosa, we get these glands here. What are these glands? These are the submucosal glands, and the submucosal glands are characteristic of esophagus. So the moment you see stratified squamous non-keratinized epithelium, the 4 layers of GIT, okay, you see this 4 layers, that's a slide of GIT. You see the epithelium, that's stratified squamous non-keratinized, and you see the submucosal glands here. So this is the esophagus. Inner circular, outer longitudinal muscle, and outer one is adventitia. Outer one is adventitia. That's the esophagus. Now this is the fundus of the stomach. Fundus, you can see this tall and columnar epithelium. This depression is what we call as the gastric pit. The gastric pit in stomach is less deep. It is less deep in stomach. It is more deep in pylorus. That's pylorus. So the gastric pits are deeper in pylorus. They are less deep in the fundus. Fundus, they are less deep. In fundus, the gastric pits contain the gastric glands. They contain gastric glands, and this gastric gland contains the chief cells and the parietal cells. So this is a very, very colorful slide. Colorful slide. That's a slide of fundus of the stomach. Clear? So epithelium is simple columnar. Gastric pits contains gastric glands, which contains chief cells and the parietal cells. You can see this lining. This is the muscularis mucosa. That's the submucosa. This is the muscularis externa, which has inner circular, outer longitudinal muscles. We compare this to the pylorus, and the pylorus will have deep pits. Gastric pits are deeper in pylorus, and the cells are less. The gastric gland contains lesser number of cells, so it is not a very colorful slide, right? So that's about the pylorus. Now we move on to the small intestines. The moment we see this finger-like processes here, this is the small intestines. What is this known as? Villus. So the moment we see the villus, this is small intestines. Now how do we differentiate between a duodenum, jejunum, and ileum? So you see the submucosa. These are the villus. See the submucosa. In the submucosa, we get glands, glands, glands here. What are these glands known as? The Brunner's glands. Brunner's glands. So villus with Brunner's gland. This is duodenum. Duodenum. Villus with lymphoid follicles here. What are these lymphoid follicles known as? Peyer's patches. So villus with pairs patches, this is the ileum. Ileum. And villus with nothing specific here. Okay, now this thing is gone here. So villus with nothing specific here, nothing specific. No Brunner's gland, no pairs patches. So that is jejunum. So villus with Brunner's gland, duodenum. Villus with pairs patches, ileum. And villus with nothing specific, that's jejunum. Jejunum. What is the characteristic of large intestine? In the large intestine, we get plenty and plenty and plenty of goblet cells. And this goblet cells secrete mucus. This mucus is dissolved during staining. So the goblet cells looks empty. Empty. So large number of goblet cells. The rest characteristic of large intestine is the same. The rest characteristic of GI is the same. So this is the large intestine. Now large intestine, plenty of goblet cells with lymphoid follicles. What is this? Appendix. Okay, so that becomes the appendix. Okay, fine. Clear to all of you? Now coming to this, what is this slide of? That's a slide of liver. And in this liver, what are these hexagonal structure known as? This is the hepatic lobule. You can see this. This is the hepatic lobule. In the center of the hepatic lobule, you've got a central vein here. Central vein. At the periphery, we have got this portal triads. At the periphery of the hepatic lobule, we have got this portal triads. In the center is the central vein, and radiating from this central vein, these are the hepatocytes. Hepatocytes. In between the hepatocytes, we get sinusoids, and these sinusoids are derived from the vitelline vein. In this sinusoids, we get phagocytic cells, which are known as the Kupffer cells. Kupffer cells. Clear? So that's about the liver. That's a slide of liver. What is the capsule of the liver known as? Gleason's capsule. Gleason's capsule. Clear? This is the portal triad, which contains the hepatic artery, portal vein, and the bile duct. Now these are all serous acinus. Serous acinus. So this resembles to a serous salivary gland unless you see these structures. What are these structures? You know, what are these structures, students? These are the islets of Langerhans. Islets of Langerhans. So pancreas, this is the slide of pancreas. Pancreas has got two parts. One is the exocrine part of the pancreas. The other one is the endocrine part of the pancreas. The exocrine part of the pancreas resembles a serous salivary gland. The exocrine part of the pancreas resembles a serous salivary gland. The endocrine part of the pancreas are the islets of Langerhans. Islets of Langerhans. Then you will be getting ducts here. You'll be getting centroacinar cells here. Centroacinar cells. Okay, that's about the pancreas. Now, what is respiratory epithelium? Respiratory epithelium is pseudostratified ciliated columnar with goblet cells. Pseudostratified ciliated columnar with goblet cells. That's respiratory epithelium. Plus, you get this hyaline cartilage here. That's the hyaline cartilage. Epithelium is respiratory epithelium. Plus, we get glands here, mucous glands. And you get trachealis muscle. So, this is trachea. Trachea. Clear? Epithelium is pseudostratified ciliated columnar. We get hyaline cartilage. We get glands as well as a muscle trachealis. So this is the trachea. These are the alveolus here. You can see this alveolus, and this alveolus are lined by simple squamous epithelium. A slide of lung. So just see the slide. The differences between the bronchi, bronchioles, terminal bronchioles, respiratory bronchioles, alveolar duct, and alveolar. Okay. So in bronchioles, cartilage is absent. Just remember this, cartilage is absent in bronchioles. And then see what happens is the muscle starts increasing and the cartilage starts decreasing. Clear? In alveolus, we have got type 1 and 2 alveolar cells. Here it is absent. Clear? So in bronchioles, we get simple ciliated cuboidal or columnar epithelium. Cartilage is absent. That's the epithelium, and that's about the smooth muscle that I have written. On this side is the epithelium, on this side is about the muscles. Now coming to this, testis. What is the characteristics of testis? That's a seminiferous tubule. So this is one seminiferous tubule, and this seminiferous tubule shows different stages of developing sperm, right from spermatogonia type spermatogonia type A, then primary spermatocytes, secondary spermatocytes, spermatids, and finally the sperms. In between this developing sperms, we get the, yes, which cells are those? Sertoli cells. And in between, we get the interstitial cells of Leydig between the seminiferous tubules. This interstitial cells of Leydig secretes what? Testosterone. Testosterone. Right. That's a slide of testis. Now you get this lumen, a small lumen. The epithelium is pseudostratified columnar. Pseudostratified columnar with stereocilia. And we get a thick muscular coat, So this is longitudinal muscle, circular muscle, again longitudinal muscle. Longitudinal, circular, again longitudinal muscle. This is a slide of vast difference, okay. Epithelium is pseudostratified columnar with stereocilia and a thick muscular coat. That's the vast difference. Now that's the prostate. We get such glands which show involutions, and we get concretions here. We get secretions inside the prostatic glands. This is what we call as prostatic concretions, or this is known as corpora amylaceae. Corpora amylaceae. Prostate contains glands, so this is a glandular tissue. It contains muscular tissue. It contains fibrous tissue. So fibromusculoglandular organ is prostate. Fibromusculoglandular organ is prostate. The secretions are known as corpora amylaceae or prostatic concretions. The gland shows involutions. That's a prostate. Now ovary. What is the epithelium which lines the ovary? That's the germinal epithelium. That is simple cuboidal. Ovary shows an outer cortex here and an inner medulla here. The medulla shows the presence of blood vessels, nerves, and lymphatics. Blood vessel, nerves, and lymphatics. The cortex shows different stages of growing follicles. Different stages of growing follicles in the cortex. Medulla shows blood vessels, nerves, and lymphatics. See the slide. This slide, the lumen is folded, and the epithelium lining this is ciliated columnar. Ciliated columnar epithelium, folded lumen. This is a slide of fallopian tube. Fallopian tube, the epithelium is ciliated columnar. Okay, ciliated columnar. You get glands here, you get muscles here. The glands are small. This is the proliferative phase of the uterus. In the menstrual phase, the glands becomes corkscrew and the muscles are seen less. The glands are more corkscrew appearance of glands. This is the uterus, the menstrual phase of the uterus. Regarding kidneys, the Bowman's capsule, here you can see the glomerulus and the Bowman's capsule. The lining epithelium of PCT is simple cuboidal without brush PCT, simple cuboidal with brush border. DCT is simple cuboidal without brush border. The lining epithelium of loop of Henle is simple squamous. Loop of Henle, simple squamous. Just remember this differences of epithelium here. Now look at this. You get this umbrella shaped cells which are characteristic of transitional epithelium with plenty of muscles here. Smooth muscles, circular, longitudinal muscles, circular and longitudinal muscles, and you get a transitional epithelium. So this is a slide of urinary bladder. Okay, that's a slide of urinary bladder. And see this beautiful slide. You get a star-shaped lumen. We get a star-shaped lumen here. The epithelium is transitional, and you get a muscular coat. This is the ureter, right? That's about the ureter. What is the epithelium of, see here, this is the thyroid gland. These are the colloid-filled vesicles here. The lining epithelium of the follicles is simple cuboidal. Cuboidal colloid-filled vesicles. We get parafollicular C cells in between. That's the cortex and the medulla of the adrenal gland. So this is the adrenal gland. This is the capsule here. This is the cortex. This much is going to be the cortex, and that's the medulla. Cortex is made up of zona glomerulosa, zona fasciculata, and zona reticularis. In zona glomerulosa, we get inverted cells like umbrella-shaped cells in the glomerula. In the glomerulosa, we get inverted U-shaped cells. In the fasciculata, we get straight cells, fascicles. They're present in the form of fascicles, so zona fasciculata. And this fasciculata, later they form a network which is known as zona reticularis. So zona glomerulosa, zona fasciculata, and the network is known as zona reticularis. This is the 3 layers of adrenal cortex. Coming down to the medulla shows chromaffin cells. Chromaffin cells are characteristic of medulla. Okay. Now, this is the pituitary gland. This is the anterior pituitary or pars anterior. That's the pars posterior or the pars nervosa. Pars anterior shows the presence of acidophils and basophils, chromophobes, chromophils. Pars nervosa shows the presence of nerve fibers. Between the pars anterior and the pars posterior, we get the pars intermedia, which shows colloid-filled vesicles similar to that of thyroid. Colloid-filled vesicles similar to that of thyroid. Clear to all of you? Okay, so that's the slide of pituitary gland. Now, this is a slide of cerebral cortex. 10 layers of the cerebral cortex: plexiform layer, granular layer, pyramidal cell layer, inner granular, inner ganglion cell layer, and multiform layer. These are the 10 layers of the cerebral cortex. Now, this is the slide of cerebellum. So this is the, what is this? Granular layer. This is the molecular layer, and in between this is the layer of Purkinje cells. You can see this Purkinje cells here. So this is molecular layer, this is the granular layer, and this layer would be the Purkinje cell layer. The flash-shaped cells, these are the Purkinje cells. So this is a slide of cerebellum, and the Purkinje cell is the only motor output from the cerebellum, and this Purkinje cell is going to inhibit the deep cerebellar and the lateral vestibular nucleus. Deep cerebellar and the lateral vestibular nucleus. That's a slide of cornea. You can see this epithelium of the cornea, stratified squamous non-keratinized epithelium, followed by Bowman's membrane, substantia propria. Okay, then endothelial cells supported on the Descemet membrane. So these are the layers of cornea. Clear? Epithelium, Bowman's capsule, substantia propria, and Descemet's membrane. So this is the slide of cornea, and finally the last slide is of the retina. The 10 layers of retina: pigment epithelium, photoreceptor, outer limiting, outer nuclear, outer plexiform, inner nuclear, inner plexiform, ganglion cell layer, nerve fiber, and inner limiting membrane. So this is the retina. Okay, students, I hope this is clear to all of you. So this is general histology, just the important things I've told you. Some MCQs we do get on histology. Thank you to all of you. Thank you. In case of doubts, please do get back to me. Thank you.